Have you ever thought about how sneaky prostate cancer can be? It's often called a ticking time bomb, because many men live with it without even knowing. It develops quietly, without clear symptoms, which can make it harder to treat if found late. Here's the good news. Catching it early can save lives. Did you know that 1 in 8 men will be diagnosed with prostate cancer at some point? That's a lot of people. In the US alone, over 288,000 new cases are expected this year, and sadly, around 34,700 men may lose their lives to it. But here's the hopeful part. When caught early, the survival rate is a whopping 98%. That's why it's so important to know the warning signs. In this guide, we'll walk through 7 early signs of prostate cancer you should never ignore. Your health matters, and knowing these signs could make all the difference. Let's start with the basics. What exactly is prostate cancer? The prostate is a small walnut-shaped gland just below the bladder, and it plays a big role in male reproductive health. Its main job is to produce fluid that protects and nourishes sperm. The most common type of prostate cancer is called adenocarcinoma, which starts in the gland cells of the prostate. But here's the tricky part. Not all prostate cancers are the same. Some grow so slowly that they don't cause symptoms for years, while others are aggressive and spread quickly. That's why early detection is so important. Knowing what to look for and acting on it early can make a huge difference. 7 early warning signs of prostate cancer. Number 1. Frequent urination or waking at night to urinate, nocturia. Do you find yourself running to the bathroom more often, especially at night? This could be a sign that something's up with your prostate. The prostate surrounds the urethra, the tube that carries urine, and when it enlarges, it puts pressure on this tube. That's why you might feel the need to urinate more frequently. Now, not all frequent urination is caused by cancer. It could be an overactive bladder or a condition called benign prostatic hyperplasia, BPH. But if it's persistent or getting worse, it's time to see a doctor. Early detection can make all the difference. Number 2. Painful ejaculation. Have you ever experienced pain during ejaculation? It's one of those symptoms that's easy to overlook, but it could be your prostate sending a warning. This pain can show up in different places: your penis, testicles, rectum, or lower abdomen. Occasional mild discomfort isn't usually a big deal, but if it's persistent or getting worse, it's worth paying attention. The prostate produces seminal fluid, so when it's inflamed or affected by cancer, it can disrupt this process and cause pain. Don't ignore this symptom, especially if it comes with urinary issues. A quick chat with your doctor could set your mind at ease, or catch something early. Number 3. Blood in urine or semen. Seeing blood in your urine or semen. That's not something to brush off. Even if it's just a small streak or only visible under a microscope, it could be a sign that something's wrong. When it comes to prostate cancer, bleeding often happens because a tumor is damaging nearby blood vessels. But don't panic, it's not always cancer. It could also be an infection, inflammation, or a urinary tract injury. Either way, this is your cue to see a doctor. Catching the cause early can make all the difference, no matter what's behind it. Number 4. Pain while sitting. Does sitting down sometimes hurt? It might seem like a minor inconvenience, but it could be linked to your prostate. The prostate's location, right below the bladder, means that an enlarged prostate or tumor can create pressure in the pelvic area. This can make sitting uncomfortable or even painful. If this pain is sticking around or getting worse, especially if you're also dealing with urinary changes, it's time to act. Your doctor can help figure out what's going on and get you back to feeling like yourself. Number 5. Pain in the back, hips, or chest. Have you been dealing with persistent pain in your back, hips, or chest? It's easy to chalk it up to aging or a tough workout, but it could be something more. When prostate cancer spreads, it often targets the bones, causing deep, ongoing pain that doesn't go away with rest. If this sounds familiar, don't ignore it. Getting it checked could either ease your worries or catch something serious early. Either way, it's worth it. Number 6. Swelling in legs or feet. Ever notice swelling in your legs or feet that won't go away? It might not seem connected to prostate health, but it can be. Prostate cancer can spread to lymph nodes, which help drain fluid from your body. When these nodes are blocked, fluid builds up, causing noticeable swelling. If the swelling doesn't go away or keeps getting worse, especially if you have other symptoms, it's time to see your doctor. It could be the clue that helps catch something early. Number 7. Numbness and weakness in limbs. Have you felt numbness or weakness in your arms or legs? It's not something to ignore. When prostate cancer spreads to the spine, it can press on the spinal cord and disrupt nerve signals. This might feel like tingling, numbness, or even loss of strength. If this happens, act quickly. Getting it checked could prevent more serious problems and improve your quality of life. Now that you know the signs, let's talk about risk factors. Age, family history, ethnicity, and lifestyle all play a role in prostate cancer risk. The good news? There are steps you can take to lower your risk. Eat a healthy diet, stay active, maintain a healthy weight, and talk to your doctor about screenings if prostate cancer runs in your family. Listen to your body. If something feels off, don't ignore it. Early detection could save your life. And remember, sharing this information could help someone else too. Let's work together to spread awareness and keep more men healthy. Your health is worth it.